never see once around.
The mobile stroke unit is a portable, a rolling primary stroke center. So the mobile stroke unit allows us to get to a patient's side, whether it's at their place of work or their home, and initiate the same care that would be initiated in an emergency department, but a lot faster.
There's the phrase that we commonly use, time is brain. What that refers to is that when there's a blocked major artery going to the brain, there's about 2 million neurons per minute that are lost irreversibly. Prior to the mobile stroke unit, what was happening to most of these patients is they were taken to the closest stroke hospital. In Suffolk County, many of these are primary stroke centers that have no interventional capacity or capability whatsoever. If we can get that patient directly to a hospital that can provide interventional services, that saves them a tremendous amount of time and saves them a tremendous amount of brain.
So the earlier you recognize a stroke in you or a loved one, and the earlier you call emergency services, the quicker we can get you the treatment that you need. And the quicker we do that, the less brain tissue that's lost.
In Suffolk County, fire rescue and emergency services receives the 911 call. When they receive that call, they ask questions about what is the patient's complaint.
Things like difficulty with speech, numbness or weakness, especially if it's only affecting one side of the body, or altered consciousness, or sudden onset of severe headache, like worst headache of life. These types of signs and symptoms will indicate to the EMS control that we should send the mobile stroke unit out to respond.
We evaluate the patient in conjunction with the local EMS agency, and if we feel the patient might be having a stroke, the patient is moved into the mobile stroke unit.
So through teleneurology, our neurologist can actually see the patient, interact with the patient, and perform a quick examination. If the patient demonstrates signs and symptoms of a stroke, then that patient will undergo a CT of the brain. So if we see hemorrhage on the CAT scan, what that tells us is we need to bring the blood pressure down and transport the patient to a comprehensive center that can deal with the brain hemorrhage. If we do not see a brain hemorrhage, but the patient shows signs and symptoms of a stroke, we suspect that there's some type of occluded blood vessel in the brain, and that patient get clot-busting medication right in the field. We can then perform a CAT scan angiogram that can assess the patient for what is called a large vessel occlusion. If the patient has a large vessel that supplies the brain that is occluded with clot, then we know that that patient needs to go to a comprehensive center for interventional stroke care.
If we find that you don't have any indication for surgical intervention, then we're able to bring you to your local stroke center.
We wanted to be able to position the mobile stroke unit bases so that they had a response area of approximately 10 miles of a radius. So for that reason, we positioned one mobile stroke unit base on the service road of the expressway at exit 57, and the other one is just off of the service road at exit 68. And both of them allow ready access to the expressway, both east and west, as well as easy north-south access from Betts Highway and also from William Floyd Parkway. The response territory starts approximately in East Islip and ranges to Riverhead and covers the entire island north to south from the Atlantic Ocean to the Long Island Sound.
We're really excited about adding a third mobile stroke unit to our program this year. And the third mobile stroke unit will expand the coverage that the other two units have provided to cover the North and South Forks.
So we've partnered with 45 agencies that provide ambulance response in the communities that we serve. You have a call? Go ahead. So as you can see, we've relocated inside of the mobile stroke unit office building because the mobile stroke unit just had a call. So they're en route to a potential stroke patient as we speak. Since the program inception in 2019, I believe that we've clearly proven the worth of the mobile stroke unit. We have many, many patients, hundreds of patients who have benefited by being able to be treated in the mobile stroke unit. And we do see patients that present with an inability to speak, total paralysis on one side, and after treatment within 24 hours, they're walking, they're talking, and they're fine.